Please subscribe to the channel and press the bell icon to be notified of the latest videos. This is Sage for Kalkinemedia, and thank you for joining us for our educational series. Today we're covering what is Health Maintenance Organisation, or HMO. The acronym HMO stands for Health Maintenance Organisation. HMO intends to offer a wide range of medical treatments through a network of providers who have agreed to give services to HMO members. An HMO will most likely give insurance benefits for a wider variety of preventative healthcare services than another type of plan would. For a yearly or monthly charge, HMOs offer health insurance coverage. An HMO restricts member coverage to the medical treatment given by a contracted network of physicians and other healthcare providers, and these contracts enable cheaper premiums than conventional health insurance because health providers benefit from having patients diverted to them, and they also impose more constraints on HMO members. When deciding whether to enrol in an HMO insurance plan, consider the cost of premiums, out-of-pocket payments, any specialised healthcare needs, and whether having one's primary care provider is essential. The willingness to combine economic and care quality incentives was the driving force behind the formation of HMOs. Alternative healthcare payment arrangements like fee-for-service designs, on the other hand, may have an economic incentive for those providing care to do so incompetently. What are the HMO subscribers' rules? HMO members pay a monthly or annual fee to access medical services offered by the organisation's network of providers. Still, they are restricted from receiving treatment and services from doctors who are members of the HMO network, and some out-of-network services, such as emergency care and dialysis, may nevertheless be covered by the HMO. Those covered by an HMO might be required to live or work within the plan's network area to be eligible for benefits when a subscriber receives emergency care outside of the HMO's network, and the HMO could cover the costs. Non-emergency, out-of-network care, on the other hand, must be paid for out of pocket by HMO members. An HMO usually has low or no deductibles in conjunction with inexpensive premiums. Instead, for each clinical test, visit or medication, the organisation charges a co-pay. What are the benefits of HMO? The first and most evident advantage of joining an HMO is the reduced cost. There is a need to pay monthly or yearly set premiums, less costly than conventional health insurance. On the other hand, these plans frequently feature low or no deductibles and lower co-pays than other plans. And billing has also proved to be easier for individuals who have an HMO. There's also a good chance you'll have to deal with the insurance company directly. The reason for this is that you should select a primary care physician who will be responsible for administering your treatment and care. This expert will also make recommendations for services on your behalf. With an HMO, the quality of care is usually better. But again, it's because people are motivated to have annual physicals and seek therapy as soon as possible. What are the drawbacks of HMO? If you choose to pay for an HMO, you will be limited in how you could use the plan. It is essential to choose a physician who will be accountable for your medical needs, including referrals and primary care. This implies that if you visit a doctor who isn't in the network, you're liable for any costs incurred, even if there isn't a contracted doctor in your region. If you desire your HMO to pay for any visits, you'll need references for any specialists. So if you want to see a dermatologist or a rheumatologist, for example, you'll require a reference from your primary care physician before you can see one for the plan to cover your visit. If you don't, you'll be liable for the entire bill. For some medical claims, such as emergency cases, there are stringent standards that must be met. For instance, most definitions of what defines an emergency are strict. Therefore, if if your illness does not qualify, the HMO plan will not cover you. If you like this information, please like, share, comment on the video below. Subscribe to the channel and press the bell icon. You'll be notified of the latest videos. But for more information, regular updates, head to the website kalkinemedia.com. Sage here for Kalkinemedia.